Okay, let's continue with part two of the video. The rest of the exercises make word combinations using a word for each box. Look at A and B's opposite to up. Blood, stained, breath, sounds, plural, verb, rub, productive cough, vocal resonance. Is your cough productive? Rewrite the questions using words that are better known and to patients. Look at the opposite to help. Is your cough productive? Do you cough up any phlegm? What color is the sputum? What color is the flame? Is it ever purulent? Is it ever yellow? Have you ever had hemoptysis? Have you noticed any blood in it? Do you suffer from dyspnea? Any problems with your breathing? Are the following statements true or false? Give reasons for your answers using your medical knowledge and be opposite to help. A patient who has a loose cough produces phlegm. True. Crackles are heard when the airways are narrowed. False. A patient who has a non-productive cough produces sputum. False. Wheezes are typical of pleurisy. False. A pleural rub is a sign of asthma. False. Complete the description of herpes zoster um, by replacing the medical words in brackets with ordinary English words. Look at A and B opposite to help. Tingles herpes zoster usually starts with pain and soreness, then red. Spots, macules appear that develop into groups, spot blisters, vesicles over a particular area on one side of the body. In most patients, new lesions continue to appear for 3 to 5 days. Small blisters, vesicles become filled with pus, bacillar, and then form scabs crossed. In severe cases, there may be scars cicatrizes afterwards. Read the description of the rash of rubella and complete the notes. Look at the MB opposite to help. Spots are scattered pink macules which appear first behind the ears and then on the forehead, and the rash spreads rapidly, first to the trunk and then to the limbs. Location and distribution first behind the ears and on the forehead, then the trunk and limbs. Grouping scattered. Type of lesion, macules, color pink. Complete the notes for the rash in the photograph and suggest a diagnosis. Look at the MB opposite to help. Location and distribution, widespread on the chest and abdomen scattered, grouping scattered. Type of lesion, small macules with some scales, color pink. Complete the notes for the lesion in the photograph and suggest a diagnosis. Look at the image opposite to help you. Location distribution below lateral angle of the left eye, group in single, type of lesion audio, colorway pink. Write the corresponding medical terms for the ordinary English words and say what kind of force is involved. Look at the opposite to help you. Compound word, bruise, medical term, contusion, hematoma, type of force, blunt, cut, incise, wound, sharp, raise, abrasion, blunt, scratch, um, linear abrasion, blunt, stab wound, um, wound, sharp, and tear, penetrating wound, sharp, tear, laceration, blunt. Choose the correct words to complete the description of the injuries shown in the illustration. Look at the opposite to help you. There are sketches, races above the left eyebrow and on the left side on the neck. Contusion, laceration to the left side of the lower lip enters to the left cheek. Write a description of the injuries shown in the illustration. Look at the MB opposite to help you and at 32.2 above. There is a location there on the left shoulder and an incised wound, a cut approximately 6 centimeters in length above the left nipple. Complete the sentences. Look at the MBC opposite to help you. Frequent changes of position are necessary in the mobile patient to prevent the development of a pressure spread. He had several stab penetrating wounds in his abdomen from the knife. He was knocked unconscious by a heavy blow upon the head, and the ones were only superficial and required not treatment. Look at the conversation in a opposite and complete the notes about Mr. Jones. Use medical terms where possible. CO, frequency, and nocturia for 1 year, no dysuria or hesitancy, stream flow, a little weaker, no incontinence part for occasional dribbling. Match the patient description of their symptoms 1 to 7 with the medical terms A to G. Look at the opposite to help you. I have to pee every half hour or so. Frequency. I get the scalding pain when I pass water. Dysuria. I have to get up several times to pass water at night. Nocturia. I have to rush to go to the toilet. Urgency. I have trouble getting started. Hesitancy. I can hold my water. Incontinence. I passed some blood in my urine. Hematuria. Write the doctor's questions for his symptoms. Describe the findings of the laboratory reporting work to the guy be opposite to help. There was a trace of blood, lost proteinuria, and no casts. A doctor is talking to a patient during an ophthalmoscopy. Match the underlying expressions uses 1 to 4 expressions with similar meanings from A opposite A to D. Right, Mr. Go, because you've been having these headaches. I'm going to have a look at your eyes, particularly the back of your eye, the retina. I'm going to put a couple of drops in your eye, which will make it easier for me to see the retina. After a few minutes, you may find your vision as blurry. This will wear off after about an hour. I need to get rid of as much external light as possible. This means closing the blinds. Now I'd like you to look straight ahead at that clock. This takes a few minutes and your eyes might feel a bit tired, so you can blink if you need to. I don't want you to look at me, look at the clock. The aim, the examination is done with dimmed lights, matches with the tree. B, a topical pediatric solution, matches with number 1. 2A dilation, matches to the 2. 1 fixate on a target, matches to the 4 1. Complete instructions, look at the B opposite to help you. Wrap the cuff around the patient opposite arm. Place the diaphragm over the area of the brachial artery. Raise the patient's arms so that the brachial artery is the same height as the heart. Close the valve on the pump. Pump up the pressure to at least 150 millimeters MAHG. Open the valve a little and slowly deflate the cuff while listening and watching the pressure gauge. The first sound that you hear in the flow is the flow of blood through the brachial artery. The value on the gauge that type point is systolic blood pressure. Continue listening while you slow the flow. The cuff of the diastolic blood pressure is measured when the sound completely disappears. Complete the test, look and see opposite to help you. Phlebotomists are especially trained in taking blood. They are skilled at venipuncture, puncturing the vein to take a blood sample. The raised to hand foot can be used, but for more often a vein in the inner part of the elbow is used. If it's difficult to locate a suitable vein, the patient may be asked to make a fist or a tourniquet may be applied on the upper arm to make the vein more apparent. Afterwards, their dressing is applied and the patient is asked to press gently. This helps to stop the bleeding and prevent bursting out the site. It is important that specimen tubes are labeled correctly before they are sent to the hematology laboratory where a full blood count or other investigations will be carried out. Thank you so much, and that will be all.